Hello, lovely people of Africa and beyond. This is Health Afrik on AAU TV. AAU TV is the voice of higher education in Africa. Today on Health Afrik, we are going to talk about massage therapy. What do you know about massage? I know sometimes you let a friend take you through massage just to relax your nerves and your muscles and all, but therapists say it's the wrong thing if the person hasn't undergone training. So today, I'm going to be speaking to Mr. John Agbuza, who is going to take us through the right procedures of massage. And I know you will enjoy this. Stay with me, let's speak to Mr. Agbuza and let's learn something. I am Bridget Amadente. Do stay tuned. Now we are here with Mr. John Agbuza to help us delve more into the issues of massage therapy. Mr. John Agbuza, you are welcome.
Thank you.
It's great to have you on the show today. All right, so what do you do at Panache Body Lab?
We do massage, and we do facial and skincare. We do coarse cutting, we do stretch mark remover, we do tattoo remover, we do nails, we do pedicure, we do manicure.
Yeah, so let's delve into the whole issue of massage. What then is massage?
Okay, massage is to manage health condition and enhance wellness. Generally, we use the oil, the warm water, and our hand to help person relieve pain, even stone bath.
Okay, so what are some of the benefits that one will obtain after going through a massage?
Some of the benefits are the person will be relieved of pain, it help in blood circulation. It also help to improve lymphatic drainage system. It also help even the skin tone because of the kind of the oil we use that also penetrates the skin. It helps to relieve tensions in your body and help your body to be fully relaxed and be well invigorated.
Okay. Before we started, you indicated that it helps to tone the skin. I'd like you to hit a bit on how massage helps to tone the skin.
We have so many oil we use, like olive oil, coconut oil, and other essential oil that have powerful benefit to our skin. Even sometimes we use the cream we use in the house, we use them so that we can be able to get very good color and even color. Which are some of these oil, they have very powerful ingredients that that help our skin to look good, that give you color, especially coconut oil. It helps to even remove those rashes, skin irritation, acne, and help your skin to be even.
Okay, so how often should one undergo a massage?
I always answer that as long as you want to be relaxed. You can even do it every day, but not in other vigorous type of massage. You can always do Swedish for your muscles to be fully relaxed.
Okay. So what do you do at Panache Body Lab when someone comes here and the person says, I want to undergo a massage? What are some of the processes you take the person through?
Before you undergo a massage in Panache Body Lab, we take you through a process called consultation. Okay. These are where we ask you questions, what you want to achieve, why do you want to do the massage? Based on your response, we will know how to guide you and how you can be able to choose a type of massage that will help you to meet your needs.
Okay. So the type of massage to meet your needs. For the purposes of this interview, I'd like us to hit on deep tissue massage and then the Swedish massage. So kindly explain what a deep tissue massage is.
Deep tissue massage is to relieve a deep pain deep inside a tissue, like the nut area, the area that maybe you walk at yourself and you have tense inside your muscle. So for that pain to be released, you add a little pressure so that pain can be relieved inside those tissue area. Then the Swedish massage is just for relaxation, for your body to be relaxed. Even sometimes we might feel we are sick. We go to hospital, doctor will say you need a rest. Actually what it means, even when I'm not there, it means that you should go and get a massage. Just go and get a massage.
Okay.
So that your body can be fully relaxed.
Okay. Okay, so what do you do after a massage? After a massage, is there any specific thing that you have to do, or it's just everything is just done?
After a massage, all we advise you to do is to drink plenty of water, so that if there is anything, any toxic that accumulates at that time, that we be able to relieve easily through defecation, piss, or anything.
Okay.
So that is the only advice we give. Then you can go and relax and sleep.
Sleep, okay. So can pregnant women and children undergo massage?
Yeah, they can undergo a massage. But for pregnant women, for at least there should be more than 12 weeks in their pregnancy, okay, so that there will not be a complicated issue like miscarriage or something.
Okay. What about children?
Well, children can as well, go in massage. Even knowing and unknowingly, we do massage for our children. When the baby is crying, you rub it back. You are helping the patient to calm down. Before you know, the baby go to sleep.
Oh.
Yes. And also, there is also another type of massage, which reflexology. Reflexology is under your leg, or your palm, or your ear. All your organs in the body are located in this area I may mention of. Now, when you are tense, even when you don't want to pull your clothes, there is a way we press in those areas, then your body will be also relaxed. So if your baby is crying, you can press the hand, try to, or it's tense, you can press those areas in the palm or under the leg, so they can be, before you know, they will sleep.
Yeah, but with pressing a baby's palm and under the legs, will mothers need training to be able to do this effectively? Otherwise, they might end up doing something.
Definitely, they need training to do that.
Okay.
Before you do any type of massage, you have to undergo training so that you can do it and know what you are doing. Sometimes we are doing something, you don't know what you are doing. So it's better you are doing something, you know what you are doing.
And normally in our homes, when our father or your mother comes back from work, they say they are tired, they are back. So they will lie on the floor and let maybe a child, maybe 8 years, 7 years, depending on the weight of the child, stand on their backs so that they massage them hand, and the tension and then the stress is all gone, and sometimes massage their shoulders just to release some tension. And then maybe the kids don't even know what they're doing. Would you advise that people still do this?
So, to me, I would say no. One, you will not call that a massage. You can call it baby jumping on daddy's back. So, this thing we do like that, we can cause harm in our body, you see. So you have a spinal cord that passes your back, and you are asking the baby to jump, and the baby don't know much about all these things, then he jump on your spine. What happens? They can even jump in the area that you are not tensed, and he add more, he add problem to that area. And what if you jump in a place that you have sore inside your tissues? You jump in that area, you have problem in that area. So these things are not really advisable. I sometimes hear when the mothers, the father will say, "Oh, my wife massaged me. My husband massaged me. Oh, I don't need to go to a spa." You need to go to a spa. It's not something you just look. Maybe if I start doing massage now, you say, "Oh, I'm passing over it," but I'm very sensitive on what I'm doing. Even sometimes when you're massaging somebody or a client, you see that some part will be a little bit hot. We know all these things, and we know where to spend more time so that the person can be able to relieve the tension and fully relax. You get, so all these things are not really helping us when we think that we are professional and we are doing what we are not trained for.
So you advise that we shouldn't even do, we should just go to the spa to get proper massage and relax.
Yes, you should come to a spa and have a proper massage. Or even still, you can ask your wife or your husband to go for training so that he can be able to give you a professional massage.
Oh, okay. And then there are other times where we use, what do you call this thing? Deep heat, something hot. Then you rub the back, and that is also called, is that also called massage? Where you use just the cream and then you just rub the back, and then it's hot and then you can feel it in your tissues and all of that. Is it also massage, or it's not classified as massage?
No, it's a pain relief cream. It's not a massage. When maybe you are having pain, you can buy deep heat in any pharmacy, then they will give you rub in those areas that you have pain. It's not a massage.
It's not massage.
No.
Okay. It's been great having you here. Thank you very much. Now we're moving on to the practical session where Mr. John Aguza will take us through the process of massage. And I know you're going to learn a lot. Stay tuned.
I'm about to start the massage process. So I have sanitized my hand because I am ready to start the treatment. So all I need to do is to dip hand inside the oil, then I set on my hand. I have to spread this oil in effleurage form in the body before I start this treatment. So once I start the treatment, there is a connection, so I don't have to lose that connection. I don't have to remove my hand totally from the client's body. I will spread the oil until it's enough for me to start the massage. So this process, I don't just go and start hitting the person's body like that. So the process of doing a deep tissue, you have to do some sequence in Swedish massage so that the person can be able to relax.
I realize you're using that part of your hand a lot. What is that supposed to?
This one will help me to, be able to relieve a deeper pain inside the tissue. So any place I feel a little bit that is like a head or something, it's like somebody is having fever, you see that the body is somehow hot. So when you are massaging, you are passing the body, you will feel that tension around the body area that are very tense. So when you get to that area, you add pressure and spend some time there to relieve the pain in that area. I'm using the elbow because it will help me not to need the massage after I finish. When you use your finger, when you press so long, before you massage 2 or 3 people, your hand will be weak.
Yeah.
So when you are doing the deep tissue, it's advisable you use the elbow so that you can be able to help the person and as well help yourself.
So as a therapist, how do you know that the patient is truly relieved after the massage?
During the process, when you are going through the treatment, after you have tackled those tense muscles and those areas that need attention, you can be able to, sometimes even some clients can slip off you. They will be relaxed, they will slip off. Before you know, they are making they are sleeping. So you will definitely know. Even sometimes before I get to the leg part, see under the leg you can locate the heart under the leg. You see it's beating, like you can see that the person is falling asleep. So the person will be relaxed. And also when you listen to yourself, most times the way you feel, you can be able to know how the client is feeling. So it's not about just your hand, but all your part of your body is also working. And the treatment process continues.
And is this a massage of the brain, or there are nerves in there that connect to the whole body?
Yes. Every part of the body, they are actually connected. Now, if I spend more time on the head, like doing this head massage, you can see it can be able to affect, the benefit can affect any part of the body. Even when you are pressing your head, you are telling blood to come that area. You are drawing attention in the body system. that this place needs attention. So when such blood circulation occurs, the body is always already ready. That's why even most cars owners, before they start up, they warm the engine, see, before they can move. So earlier on I mentioned some of the benefits on the skin. As you see, you have some rashes on the body. So with the help of the oil, there's a little bit of coconut oil and palm oil. These have very anti-inflammatory property that can be able to help in subduing these rashes.
So we are wrapping up here. I'd like to know, in your years of practice, how often do you get people walking in to get a massage?
I would say frequently. Well, aside that, in my years of therapies, I do put people on treatment. Even, doctors, lawyers, those people who who sit for a long time in the office, who stand, for the surgeon. I put them on treatment. Some are in 2 weeks, some are in 1 week, some are in 1 month. So depends on how they, stress themselves. And the surgeon experience I have that came from massage, that you have done massage once all his life. So when he came, I introduced a treatment plan for him. Then he said, okay, because I always stay for a long hours to do surgery, so I need something that always be helping me to invigorate it, return my body to normal. So I introduced a treatment plan for him, which is 2 weeks interval. It can be deep tissue, it can be soft tissue switch, depending on how the muscles are at that moment. So till over 1 year now, it's enjoyment, and he always calm and always happy. Okay. And he has really testified to me that the process has really helped him to manage his body system.
Okay. So your final words, what would you tell someone out there who thinks someone can massage him and he doesn't need to come to the spa?
I would say to them that in every organization, you always need a professional to help you get what you want. I would say you need to get a professional to work on your muscles and tissue for you so that you can have the best and result you desire. It's not just to do this. It's very simple as you look. Someone can go to YouTube and say, let me do it like this. It's simple, but there are techniques. There are things that is not said. I experience that you might not know that I know. You get it. So that makes me a professional. That makes me a better healer. That makes me a better therapist than any other person who don't undergo the training. You are working now. You are doing this. I can just, it's simple. Let me carry the camera. I can video with my phone and all that, but I'm not a professional. You get it. So you must undergo something, a training, before you can become a professional and before you can deliver where that will help meet the needs of individuals.
Okay. All right. Thank you very much. It's been a pleasure being here and seeing the whole process. Seems like we are all coming back here to get a proper massage after a week's work. So hope to see you soon. Thank you very much.
Thank you.